हेलो एवरीवन। आज हम लोग जनरल सर्जरी के बेसिक इंस्ट्रूमेंट्स के बारे में डिस्कस करने जा रहे हैं। एग्जाम्स में कौन कौन से इंस्ट्रूमेंट्स पूछे जाते हैं, हाउ टू गिव देयर आंसर्स, हाउ टू गेट गुड मार्क्स, हाउ टू होल्ड द इंस्ट्रूमेंट्स, हाउ टू आइडेंटिफाई देम। तो एक एक चीज़ को आगे बढ़ते हैं, एक एक करके स्टेप बाय स्टेप आगे बढ़ते हैं।
Our first instrument is BP handle or surgical scalpel. BP stands for Bard Parker handle. Actually, Charles Russell Bard and Morgan Parker, they were the founders of the Bard Parker company. It is made up of stainless steel. Surgical blade is placed over the narrow part and the grooves on the body helps in a firm grip. It is usually of three different sizes, 3, 4 and 7. Handle number 7 has a thin, short shank for making fine and precise incisions. We hold it like a pen. Our next segment is hemostatic forceps. This is a long, straight tip traumatic hemostatic artery forceps, also known as Roster-Peen forceps. As you can see, there are the two finger rings in which we place the thumb and the ring finger for the grip. The index and the middle finger is used for assist and guiding. The ring finger provides the maximum mobility. These are the parts: finger rings, shank, box joint, and the two jaws. There are transverse serrations which run along the entire length in the jaw, and it is used for occluding larger blood vessels or on heavier tissues. In the medium segment, there is curved crile hemostatic artery forceps. It is used for occluding bleeding vessels for before cauterization or ligation. The next instrument is Kelly's hemostatic artery forceps. The difference between criles and Kelly's is that serrations run in the whole jaw in the crile hemostatic artery forceps and it doesn't in the Kelly's. And in the last, mosquito forceps or Halsted forceps, it is used for occluding the fine blood vessels. The next instrument is a straight tip cocker or Ochsner forceps. Its jaw has transverse serrations with a tooth at the tip. It is used to hold tough structures like fascia, sheath, or to hold the muscles. There are other contributions by cocker which is usually asked in the exams. The next instrument is Ellis tissue holding forceps. It is used to lift, hold and retract slippery tissues like tendon, fascia or sheaths. There are tooths and groove at the tip of the jaw which provides a firm grip. The next instrument is Babcock forceps. It is used to encircle or grasp delicate structures such as ureter, fallopian tube, ovaries or appendix. It has a semicircular, rounded tip that is relatively less traumatic. There is a triangular space between its jaw at the tip to prevent the squeezing or hampering the blood supply due to the excessive pressure. The next instrument is plain adjacent tissue forceps. Its mechanism of action is spring-loaded. It has a fine tip with horizontal serrations to grasp delicate structures like nerves or fine blood vessels. This is a toothed adjacent tissue forceps having a tooth at the tip for firm grip. This is a plain tissue forceps to hold tissues. It is atraumatic and has horizontal serrations. Next is toothed tissue forceps. It is used for holding moderate to heavy tissues or during wound closure. Next is DeBakey tissue forceps. It is commonly used in vascular surgeries. There are a set of parallel fine serrations on both sides that fix into each other. The next instrument is Crile wood needle holder to hold fine needles when suturing. Its jaw has a criss-cross pattern for better gripping and a groove to accommodate the curvature of the needle. There is one more which is in a heavy body, also known as Mayo-Hagar needle holder. So in Viva, we are going to answer like, this is a metallic instrument made up of stainless steel having two finger rings, ratchet, shank, box joint and a jaw with a crisscross pattern, most likely to be a needle holder. The next instrument is right angle forceps, also known as mixture. Its jaw has a right angle 90-degree angle along with the transverse serrations. It is used to clamp, dissect or occlude the tissues. It is also used to place a tie or a vessel loop around a tubular structure. The next segment is for scissors. This is a curved Metzenbaum scissor or tissue scissor. It is having two finger rings, a shank, a screw joint and two jaws. used for cutting tissues and dissection. Next is heavy scissor or Mayo scissor to cut sutures and other solid structures. Next is Lister bandage scissor. It is angled blunt scissor in which lower blade has a flat tip. It helps in cutting dressing without causing harm to the patient. The next instrument is Heath suture cutting scissor. The curved tip helps to lift the suture up and aids in cutting without causing injury to the patient. Its tip should be facing away from the patient while cutting. Next instrument is Rampley's sponge holding forceps. It is long in size with oval and flat serrated jaws at the tip to hold the pads gauze during painting. The long length helps to aid in painting from a distance as initially the area is unsterile. Next instrument is Frazier suction tip for sucking in confined spaces such as nasal cavity craniotomy. Its one end is attached to the suction tube and the other end is used for sucking the content. Next instrument is Youngcore suction tip. It can be metallic or disposable. It is most commonly used in routine surgeries. It has a hollow plastic tube with a grip and a slightly bent shaft with a bulbous tip having a large opening. The next instrument is Desjardins forceps. It is used to grab stones in common bile duct. It is a curved which aids in retrieving stones from the CBD with no ratchets. Tip is oval cup shape with fenestration. The next instrument is a Doyen intestinal clamp. It is used for clamping bowel during a resection. It can be curved or straight. There is longitudinal serrations, hence less traumatic. Its motive is to stop the spillage of gut content without hampering the blood supply. Next instrument is Doyen cross-section towel clip. This is a Mayo towel clip or Beckhouse towel clip. It is used to hold drapes and to fix suction tube or cautery pen cable. This small one is a Bulldog vascular clamp used to occlude the vascular lumen during vascular repair or any procedure. The next instrument is a Diva retractor. It is a flat stainless steel strip that resembles a question mark. It comes in different width. It is used for deep retraction of organs and viscera in laparotomies. For grip, the handle straight strip should be placed in the palm of the hand and the hook should be placed over the top of the hand. Next instrument is Morris retractor. There is a flat wide blade with a slight concavity which is right angled to the shaft. Handle is serrated for better grip and to reduce weight. It is used for retraction in laparotomy. This is a Doyen's retractor. It has a curved blade to retract bladder and uterus in pelvic surgeries. The next instrument is Journey retractor. At one end, it has a solid blade at right angle to the shaft and other end a biflanked blade that helps while working at the edges. It is used for tissue retraction in hernia, appendectomy and thyroid surgeries. The next instrument is Langenbeck retractor. It has a L-shaped working end with a slightly angled tip for secure grip. The next instrument is Kelly proctoscope. It has a proctoscope sheath with handle and a obturator with a smooth tip to prevent injury while inserting the instrument into the rectum. The next instrument is Tittle forceps. These are used for handling sterile instruments during surgical procedures, ensuring that asepsis is maintained. They have angled tips and a large area for gripping. These are some more instruments. Kindly like, share and subscribe, and thanks for watching.